Camille Patterson, and I work at actually a nonprofit down in Fort Worth near Dallas, Texas. And my presentation is a positive approach to prevention and intervention of substance abuse among working young adults. And while we're looking at young adults, is we found that substance use most often begins in those precarious years of the late teens and early 20s. And this is when young adults are just beginning to work and they're often changing their social environments. And these environments can contribute to substance abuse risk, but they can also be resources for prevention and intervention. So what we're trying to do is to deliver substance abuse prevention and intervention training, and to do so through specific work groups and organizations. And that way it would allow us to use the strengths of the group to help with these problems. And what I'm going to go through is we have developed a training program and done some focus groups and pilot tests. I'm going to go through kind of our results of that process. But first, again, young adulthood, which I'm defining as 16 to 24 years old, but some of the other literature suggests that it might actually be 18 to 30, so some of this will apply to that range of ages. It, of course, varies between individuals on how settled you are at 24 versus 30. I know I wasn't really settled till I was 30, so. What we found is young adulthood it's really a crucial stage in developing goals and discovering meaning both in work and in your social environment. And at this age, job identity is still really ambiguous. But employment really plays a pivotal role in helping young adults to successfully negotiate this transition period between their childhood and adulthood, and to develop a healthy self-identity. And one of the things they're trying to do is to establish a border between their work and social life. And according to some of the work by Clark, this border really, it needs to have a balance of flexibility, but also some clarity, so there's not just a complete merger between your personal life and your work life. And again, with the border theory, work-life conflict can really be, we found it can be a major risk for problem drinking among young adults. And in some of the work I've done, it's a risk much more so for young adults than it is for older adults. They really are trying to balance their work and personal life, and they're still in the learning stages of that. They're learning to juggle all these things. And they can be negatively influenced by drinking climates at work because they wish to gain acceptance. And again, they're just starting their job and they're kind of learning what behavior is really appropriate. And for young adults, helping friends and coworkers avoid the risk of alcohol, drugs, and tobacco may be much more important to them than improving their own health risks. They're much more worried about what could happen to their friend and their peers than they are themselves. And some of this comes out of work on tobacco advertising, that the ads on secondhand smoke are much more effective in some ways than those on their own risk, because they have that kind of feeling of immortality, but they do worry about their peers. So we want to try and use this concern to help them. And so we have developed this program called Team Awareness Youth Edition, and this is a classroom-based program. We do it in a training session with about 8 to 30 people, which that's the ideal size is probably around 15 or 20. If you get too many people, there's not enough interaction, and the same with too few people. And our work is based on 2 nationally recognized model programs. These are SAMHSA's recognition system. One is Team Awareness, and the other is Healthy Workplace. And also on a past project, we successfully adapted these programs for workers of small businesses in high-risk industries such as construction and the restaurant industry. It's a program that we've developed. It specifically targets social norms and peer interactions, which is designed to improve the work climate and also to increase the willingness to refer others to get help. And we also look at try to emphasize some healthy alternatives to substance abuse, as well as some ways to drink moderately and responsibly. All right, and the training we did, it's a 4-hour training, as it is right now. We're also looking at doing some booster trainings eventually. But it begins with risk identification. We also go through some information about alcohol, drugs, and tobacco. And another area is reducing stigma and tolerance and increasing responsiveness. And now we're defining tolerance here. There are a lot of definitions for tolerance, but we're defining it as if you see a problem but you don't do anything about it, such as if you see substance use at work but you decide just to not say anything. And another area is stress and problem solving and substance use. And we also do a lot of exercises to build workplace communication. And they do some activities on how to listen and communicate. And this leads to the final part of the training, which is encouragement. It's the nudge model, because what we're trying to do is learn to nudge your peer to get help or to consider the idea of getting help if they have a problem. And that's done actually through, they role play with each other to practice how they would refer their friend to get help. And we started with the focus groups, and we did about 60 young adults, and then we also had another group that were professionals who worked with youth. And we gave them about 1 to 3 hours just to view samples of the training and to really give us some feedback as far as what we were doing right and what we were doing wrong and which parts they thought were most helpful. And we started again with the training we had used with our small business employees, but trying to adapt this for a younger audience. And what we found is that they really wanted direct information about alcohol and drugs. With older adults, if I just presented things directly to them, they would be very resistant and really put on the defensive. But younger adults, they want to receive this information. They want a chance to ask questions that they have. So we altered our training to be a little more direct. And tolerance was also a concern. The young adults had difficulty seeing how others' actions might affect them and how they may affect others. Some of the comments I heard was, well, if my coworker is high or hungover and they blow themselves up, well, then that's their fault. Doesn't affect me. So we try to get them to see that, you really probably don't want to be standing next to the coworker who blows himself up. It could, a lot of times workplace accidents might affect you and not the person who's been using. So we did some exercises around that, which they considered very helpful, and they also liked the communication exercises. And also, with young adults, they really appreciate the interactive activities. They don't want to just be lectured to for 3 or 4 hours. So we did a few things where they were able to do some things together. Again, I'm trying to use, since we're doing this in the group they work with or an organization they're part of, that allows us to use those strengths too in the training, because they're able to bond with each other and just in the course of the training. Okay, and our next step was we took the suggestions and modified our training, and then we did some pilot tests with it. And for this group, we actually went to student organizations. A lot of these were sororities and fraternities and some multicultural groups. And they were all university students. Some of them, most of them worked part-time, a few worked full-time, and there were some that didn't work. But we did it, again, going through their organization. And we randomly assigned each organization to either receive the training or to be in a no training control group. And we did a pre-test and then a follow-up post-test 2 weeks later. Oops. Okay, and what we found is just from the comments and feedback, verbal feedback we received, as well as kind of our impressions from the trainers, is that they really liked the opportunity to find out about some of the myths and rumors surrounding substance use. I have alcohol, but really they had questions about all types of substances. They felt like the trainings would be useful in helping in the situations they faced. And they really liked the nudge model role plays, and this is where they were practicing referring their peers to get help. And although there's some emphasis on substance use, but we emphasize in the training that they really can be useful these skills can really be useful for any sort of problem, such as referring their peer to get help for anxiety or depression, or being able even just to express your concerns about a problem you see. And what we did also was we developed kind of a list of resources for them to go to so that they would have something they could refer to their peer to do, like even referring them to go to the health center for counseling, or some numbers they could call to get help. All right, and just looking at the pre-test data, we had a pretty high-risk group. 70% had engaged in binge drinking in the past month, and 50% had done so 3 or more times, and then about 41% had used illegal drugs in the past year, and in most cases this was marijuana. Okay, just briefly the measures, again, our help-seeking, willingness to seek help and refer others measures. And we also, another key measure is work-family conflict, which I modified slightly so that it could include work, could apply to work or school, and that family would apply, since many of them are young adults, they don't have a family yet, but it could apply to their close friends. And work to family is allowing your work to spill over into your personal life, and family to work would be your personal life spilling over and affecting your work. And we also looked at their perceptions of how risky substance use was. Okay, and just looking at our pre-test correlations, we found that willingness to seek help for yourself was associated with being lower in sensation seeking, having fewer poor health symptoms, having less of a drinking climate, which drinking climate is that there's a lot of talk about drinking at work, or there's a lot of things like parties that involve alcohol that are work related. And also that they were also less likely to use substances to relax and unwind from stress. And then willingness to refer others they were less likely to be sensation seekers and were less likely to unwind with substances. And on the work-family and family-work conflict, both were significantly related to having higher levels of conflict related to having more poor health symptoms, greater perceived stress, and a higher drinking climate. And work to family was also related to using substances to unwind. Okay, and I'm just doing kind of the high points of some of our results. And since this is a pilot test, this is fairly preliminary. I'm just looking more at trends. But what we found was that those who received the training did improve on their willingness to seek help for themselves. And as far as referring others, I think the control group actually got worse on this area. So I'm not sure, it's possible that the training may have a buffering effect. Again, these are all college students, so they're in a period where there are a lot of changes going on for them. So potentially there's a buffer effect that they stay at their same healthy level if they receive the training. But I hope to explore that a little more. And this is a result I'm really excited about. It's actually different from the results I found with the older adults. And that's that the training was able to reduce their spillover from work to personal life. And it did so significantly more than the control group. So hopefully that means our training is helping them kind of keep things in balance and keep those two from affecting each other negatively. And again, this is we found that those who received the training thought different substances were a little more risky. It's not much change, but the control group, again, got a little worse, so it's possible that there's a buffering effect with the training, so the training may be protecting against the tendency for young adults to gradually think substances are less harmful. All right. And some other results suggest that the training may be effective in reducing binge drinking. I don't really have a large enough sample yet to see significant results, but I'm encouraged by the trends I see. So we need to kind of look at a larger sample to see how effective the training really is. And just to kind of sum up, I feel like there really are a lot of unique issues for young adults that should be considered when you're doing prevention programming, and really also in doing any kind of therapy or intervention. There's just some unique things. And really, by doing things in the workplace, you really have an opportunity to use those group interactions as a strength. We know that the workplace can have a negative, and an organization can have a negative influence on behavior, but we can also use those strengths to help protect against substance abuse. And then finally, the conflict between work or school and a personal life is really a big issue for young adults. And training or therapy may be able to help them to deal with this conflict and learn to keep their life better in balance, and to keep that flexibility between both spheres of their life, but also to have some clarity so they can really separate it and leave one area of their life behind if they need to when they're at work or in their personal life. All right, and this is going to be, hopefully, we're going to do a much larger study which will look at the effectiveness of the trainings. I'm going to use this training and then this 4-hour training and then add probably a 2-hour booster training for them. And we'll do this with a larger and more diverse sample. It's designed primarily to be delivered within a workplace, and we would go into the actual workplace and do the training. And we also, with our help-seeking component, the resources we look at like the employee assistance programs or other things that the workplace may offer, and try to work that into the training so it can serve as education about that to them as well. And I also want to look more at long-term changes. These are mainly 2-week results, so we want to see is the training still having an effect after a year or two. And I would expect it would, because some of these help-seeking things can take a while to have an impact. And in fact, in some cases when we're doing our role plays, they're just really laying seeds and letting someone know how to get help. And I also want to examine kind of the interaction of personality and other social risk factors. And I think that's pretty much it. Again, there's some information on how it was developed, and I also want to thank my trainers who were a big help in developing it. Right. Oh, no, I'm at the last slide. So.